Hello, and welcome to the Early Childhood Health Consultations March webinar titled Straight Talk About Vaccines. My name is Maria Morgan, and I'm the project manager with Early Childhood Health Consultation. Our team is so excited to have you join the webinar today. The Early Childhood Health Consultation Program is in partnership with the Wisconsin Department of Children and Families, housed at the University of Wisconsin-Madison School of Human Ecology, and funded by the Preschool Development Grant. Our program is committed to supporting Wisconsin early childhood education providers and addressing health-related questions and concerns and offering guidance on best health and safety practices. Our program envisions a sustainable and statewide model, improving the quality of Wisconsin early childhood education's program's best health and safety practices, and centrally promoting the health and well-being of children across Wisconsin. The Early Childhood Health Consultation Program acknowledges the American Indian tribal nations across Wisconsin and commits to truly understanding each community's needs and addressing those needs with tailored support in promoting the health and well-being of each tribal community. For today's conversation, we will begin with introductions, have time for centralized content, question and answers, and then wrap up with some closing remarks. A few logistic reminders here in the Zoom webinar. There are two engagement features. The first is the chat. Feel free to add comments using the chat icon. There's also a drop-down where you can select your chat message to the host and panelists or to everyone. We also have the question and answer feature. If you have any questions throughout the presentation, feel free to use the Q&A icon, and you can send your question anonymously through selecting that check mark. Central to today's conversations are three core objectives. The first is to describe the role of vital signs when making health-related questions, identify the early childhood health consultation as a resource, and further explore those centralized considerations with vaccines. Today, I will be handing it over to Dr. Dipesh Navsaria, the Early Childhood Health Consultation Director and active pediatrician. So without further ado, I will hand it over to Dr. Navsaria.
Thank you so much, Maria. Appreciate it. If folks will just give me one moment while I do the old share screen switcheroo here to get my slides up there. Again, one of the wonderful things about Zoom is that it moves everything around in 50 places when you do a share screen. So there we go, all better now. All right, so thank you. It's a delight to be with you here today and spend some time talking about vaccinations. This is something that honestly one could spend a inordinate amount of time talking about. So by necessity, we're only going to be able to cover some chunks of it. But I also want to be clear that my goal here is to give you an idea about some of the really big picture topics and ideas and concepts that you can use to help you in terms of your understanding of immunizations and the value of what they provide. And also to be able to guide families when they might ask you and have questions or other things of that nature. So without further ado, I will move along here. So first of all, of course, the actual recommendations for vaccines do change, sometimes a lot, but mostly slightly every year. These are annual nuances often that happen. So please consult the most up-to-date version of the immunization schedule. And also in your state or local jurisdiction, there may be different rules that apply about what is or isn't quote unquote required or necessary. Just please make sure to be aware of those and follow those. So let's start off with this thing we call the immune system. And I will tell you, right, in medical school, I distinctly remember an entire course that was simply titled Immunology. The immune system is incredibly complicated. Like there are so many bits and pieces and moving parts to it, right, that it did take a whole course to go through it, and that even wasn't, all of it there. But I want to really boil it down to just a couple of things that are important for us to understand, because they'll help us understand the rest of what I have to share with you today. So there's two big chunks to the immune system. There's what we call the innate immune system, right? This is the built-in thing. It's automatic. It's there from birth in virtually everyone. Yes, there's always exceptions to any of these things, but they're pretty rare. And this innate immune system is, it fights pretty much everything eventually. It takes a little while, but it's not super specific and it doesn't work super quick to defeat infections, okay? But hey, it's a good thing. You want to come into this world equipped to handle kind of some of the really basic minor sorts of things that that are an issue. Here's one image, and by the way, all the images I show today are either from freely available images that are have licenses allowing us to use them, or are made by public sources like the federal government, CDC, et cetera, and therefore are also free to use. So here's one. You can see there's a cut in the skin here. Those green things are bacteria that have gotten in. And what happens, your body has this immune response. Even if they've never seen that kind of specific bacteria before, you have these mechanisms that pick up that there's, something going on. And these white blood cells called leukocytes, move in from the bloodstream to eat up those bacteria, right? They take a little while to get there. They might not even be completely successful in some cases, right? But it's there, wonderful. This is in contrast to the other part of the immune system. This is called the adaptive immune system. It's there at birth, but it's kind of dumb. It doesn't know what to do. It relies on recognizing past exposures to that thing, but there's no genetic, memory that gets passed on. It's all anew in each baby that's born. So it has to be exposed to an intruder, right? And by intruder, I mean a virus, a bacteria, a fungus, okay? It has to be exposed to an intruder at least once. Once that happens, usually it develops, this part of the system develops immune memory that's really specific for that particular intruder, whatever it may be. And that means the next time that it's exposed, it can identify it quickly and actually take care of it quickly. So this is way too complicated for the point I'm trying to make. So please don't get overwhelmed by this, right? But if you look in the middle section here, this sort of greenish blue set of cells and all, you can see we have these cells called plasma cells, and they make antibodies that are very specific. So when they find that intruder, they kind of attach onto it. And then what happens is these other cells called macrophages say, these antibodies are here. I'm supposed to chew this up, right? And in an ideal world, it works so quickly that you never even feel sick. Because the reality is, it's not, we as adults get exposed to a virus every few days, maybe even every few months, whatever, right? We actually get exposed to viruses every single day, and bacteria every single day, and so on and so forth. And most of those our body has experienced at some point in life, and we have immune memory that says, yeah, get rid of this, right? We don't even notice it, right? So our immune system is constantly working and doing this, and we don't notice it. That's the way it's supposed to work. It's amazing, right? And it just does that. Now, sometimes, the immune system forgets that memory, so maybe they need a second exposure to develop that, or a third, or a fourth, or maybe it's been 20 years and they need that renewed, so to speak. It's a little different in all these situations, right? But again, it's almost like, yes, the immune system says, I remember this, and therefore I can take care of it faster than that first part of the immune system, which is just kind of like, oh yeah, we'll take care of problems, but we're not super specific and we're not super fast about it in those ways. I want to focus on one thing about these antibody complexes, these little Y-shaped things, and that is actually the structure of them. They're also known as immunoglobulins, if you hear that term. And here you can see their ends, the tips there, which are in yellow on this slide, are very specific right? Really, really specific. So you can see, for example, if an intruder has on its surface these yellow antigens that you can see there, those ends of those antibodies, which are also in yellow, are shaped perfectly to fit right in and recognize it. Now, sometimes that yellow antigen might mutate a little bit and look a little bit different, but not completely different. Like, look at the blue over there. You can see, it's still this sort of rectangle with this curvy bit here, but oh, there's a difference in the middle there. Will this blue still fit into there? Yeah, probably not perfectly, but it'll do it. So you can still get an immune response that's just not as good, not quite as strong when there's a little variation. What if it mutates to something completely different, like this green with this kind of pointy thing? Is that going to fit in there? No, it won't, right? So even if it's the same family of virus, but it's something completely different, it's not going to recognize it, right? This is why, for example, influenza drives us up the wall. It does this little changing of its antigens every year or most years. And that's why your past influenza vaccines may be effective, but maybe not, or maybe only partially effective because there is so much variation. Influenza does that a lot. So hence why that's a good example. You take something like polio or measles, it doesn't seem to change at all. So the same vaccines we've been using for decades, yep, still good because it's never really shifted. And especially now in this day and age with COVID, right? You're hearing about all these variants and all that stuff. One of the reasons that at this point in time, as I'm speaking to you, we are not having big surges in COVID is because pretty much everything in the last year has been all variations on this Omicron variant. We haven't seen another new big variant. So it's all because of this when it comes down to it. Okay, so that's my real quick, super basic, that's how, the immune system, you can think about the various chunks of it. So let's think about something really great here. What if we had something, a way to use your body's built-in existing immune system, all the stuff that we're talking about, that I just talked about, that let you develop that immune memory, right, to significant illnesses and to specific illnesses too. And it allowed you to do that without the risk of disease-related severe illness or death or long-term complications. Because sure, you could develop immunity to some diseases by catching the disease, but you run the risk of becoming really ill, in some cases dying or having long-term complications. What if we had a way to be able to develop that immune memory without any of this, any of these disease-related risks being in play? Well, guess what? We do have a way to do that. And that's actually how vaccines work. It's using your immune system. It's saying, hey, immune system, we're gonna help you do all of this without putting you at the risk of disease-related stuff. Vaccines, in a way, I like thinking about this way, they train the immune system, right? They're helping it learn how to identify things so that when it needs it, it knows how to do it. They're instructing the immune system how to recognize specific intruders and be prepared for when they show up. They're a partner for the immune system, not a replacement. So for example, I've had families come in sometimes and this happened a lot in the last few months. I diagnose probable influenza. And I noticed that, yep, they didn't get the flu vaccine that year. Most commonly, it was, oh gosh, we just forgot, COVID has made it hard for people to remember all sorts of things, or which year did we do that and whatever. And their kids sick, not terribly sick, but sick. And they'll sometimes look at me and say, can we get the flu shot now? I say, well, you could. There's nothing actually wrong with that. You could. Except it's not going to help with this illness, right? So it doesn't replace the immune system. This is not like an antibiotic or other treatment for the illness. It is a partner to help the immune system be prepared and ready, but you got to do it in advance. Usually about minimum of 2 weeks in advance, ideally much more. Don't go cutting it that close. So just like athletic training, this has to be done in advance, and they create this better health and better protection by, again, doing this all when needed, in anticipation that you might be exposed, not something that you give when needed, because what we have doesn't work. This is an old school ad. Some of you may vaguely remember stuff like this way back when. These were all these, they used to run these all over the place. You know, Charles Atlas bodybuilding, right? So this is essentially what a vaccine kind of does. It says to your immune system, you're a weakling. You're not, you don't have that immune memory. You're not specific enough for some of these really significant illnesses. I'm going to make you tough and build you up in all those ways. Because, when someone doesn't have that immune memory, particularly if it's a disease for which a vaccine is available for, if someone has not become immunized, I always think of it that the disease is showing up and looking at the immune system and kind of laughing and going like, come on, really? Do you do anything? Do you even lift, man? So when we immunize, we enable that young child to be able to say to diseases that might come by, like measles or polio or diphtheria or tetanus or whatever. Yeah, I lift. Yeah, I know how to do this. I'm prepared for you. I'm ready. So, as we said, the immune system is complex with many parts. Please remember, there's a few things that do not actually make a huge difference. We want people to be generally healthy, right? We don't want people to be actually malnourished or whatever. But the thing is, these diseases are not affected by your diet, how much you exercise or actually work out, as opposed to those slides that I showed you, the supplements you take, the herbs, whatever you can. Yeah, I wish they did. Wow, it would make things so much better, but they don't. So how healthy you are, of course, if you become ill, it increases your chance of survival if you are generally healthy. But you can still get awfully sick, irrespective of your diet and your exercise regimen and all that sort of stuff. So this also means that contracting a vaccine preventable disease is not about making bad choices, right? If somebody comes down with, say, measles, right? Unless they made the decision to not immunize, right? Hey, it doesn't have to do with eating poorly or not exercising or whatever. Don't get me wrong, there's all sorts of other good reasons to follow a good diet and, exercise and all that sort of stuff. But it's not about preventing those specific vaccine preventable diseases. It's actually immunizations that will make the difference. And finally, I want to say, I hear people talk about this stuff, this phrase, right? Well, I've taken this to boost my immunity or whatever. No immunologist or physician knows what the phrase boost your immunity means. It's so general. It kind of has it. I think it gives people this idea that the immune system is just one big knob that you turn from low to up, right? So for those of you who are fans of the movie Spinal Tap, right? You can't turn your immune system up to 11, like is this the whole thing. In fact, if you have an overactive immune system that's attacking things it shouldn't, that's what we call autoimmune diseases, like rheumatoid arthritis and and stuff like that. So when you see these products making this claim of this will boost your immunity, what they're telling you is that they don't actually understand how the immune system works. There's all these, I showed you at least two parts of the immune system, and like I said, we could get really complicated. There's no one thing that kind of increases immunity overall. You can argue that when you immunize, you're quote unquote boosting immunity to a specific thing quite well. But to say this sort of general, take this supplement, it'll boost your immunity is not helpful. Now, historically, there's a lot of work that's gone into vaccines. I'm going to show you some graphs here, and I'm not going to dwell on the details too long, but this just shows you the years. The beginning of the red bar on the left is the years that they actually figured out what causes this disease. And then on the right, if there is anything, there's a little green bar, and it tells you when a vaccine became available finally in the US. And you can see for some of these, it wasn't that long. Look at measles. They didn't actually identify specifically the measles virus until 1953, and it took 10 years to develop an effective vaccine and have it available in the US. But hey, that wasn't so bad. Some of these, you notice, we still don't have vaccines to, like malaria, tuberculosis, HIV, and so on. And you notice like the magic that was COVID, right? Like identification and licensure came very quickly. I'm not going to turn this into a COVID talk. There's some good reasons they were able to do that so safely and honestly so effectively. But some things just have evaded us, just hard to develop vaccines for. Now here's the consequences, though. Just look at these numbers. These are incredible. In the 20th century, I mean, 500,000 people in the US died or contracted measles, sorry, not died. And then in 2021, nine cases, right? Look at whooping cough, which is pertussis, mumps, et cetera, et cetera, et cetera. These are pretty major drops, and you can just see 99 to 100% drops, which is absolutely astounding. Here's another way to look at it. This is global. This is not just the US. This is how many children died under age 5. And you can see the gray are other causes, but the colored parts of the bars are from diseases that are either preventable by vaccines or partly preventable, because some of them are larger categories. That left bar is only 1990, and you look at even just in 27 years, right, in about a quarter century, how much smaller that number has gotten. And some of these are basically gone. They just you just don't see it as much in different ways. In this slide, I know most of it's really hard to read. I just want you to look at the numbers there in the red. This is in the US. This is the cases and the deaths from these different vaccine preventable diseases. And just look at how high most of these are. 100, 99%, even 80%. Hep A and Hep B vaccines are much more recent. Pneumococcal disease and varicella vaccine, which is chickenpox, are also more recent, right? But these are, so hence we haven't seen the big drops yet, and they're also more complicated. But most of these, right, we just don't see those deaths. And to show you visually, here's what happened to measles in the US. You can see all these numbers, outbreaks happening very frequently, et cetera. And then right in the 60s, remember, about 63 or so was when it was licensed, and chunk, look at how low it stayed since. Just no difference, no change there. And I will highlight, you see the red line, which is the death rate, has stayed fairly low on this graph. But remember that measles, not super likely to kill you, but it can cause all sorts of things, including permanent irreversible brain damage, and sterility and things like that. It's not something you want to mess with. But before you think that we don't have to think about measles anymore, here's a headline I pulled yesterday from CNN. This is pointing out that measles outbreak in central Ohio of 85 cases, all in early childhood centers. Okay, so early childhood centers in Ohio in the last few months, 85 cases, primarily amongst the children who are unimmunized. So we can't let down our guard, because this is real, this is happening, and it's happening right in the US and all. But there are things that we don't see as much because of vaccines. This is a painting from 1809. You can see this patient rather dramatically has their back arched up, and they're kind of stuck in this position because the muscles along the back have all tightened. This is something called opistonus, which is seen in tetanus. This is what tetanus does to you. And before we had ways to relax the muscles chemically in people who might have tetanus, this is what patients suffered from. And it was quite painful and an awful way to live and often die. Some of you may be familiar with this. These are the famed iron lungs for children with polio. There were wards like this. You can see how many of these there are. You can see the kids' heads sticking out of these tubes. This is the only thing keeping them alive while they tried to get over polio. I have never seen a case of polio, and I'm darn glad that I never have, and that's thanks to immunizations. I've seen some cases of the outcomes of polio. I've occasionally seen a couple of adults that had post-polio syndrome. These are obviously people old enough that they did not get immunized when they were children because there was no vaccine. And then a video I want to pull for you that is a little hard to find because we don't see it as much, but people often blow off whooping cough. Now, whooping cough or pertussis in teens or adults, and even, youngish kids, is just an annoying cough. It doesn't do much. In infants, it can actually keep them from feeding. And the cough is so harsh sometimes, and they have enough difficulty breathing that it can kill them. They actually will literally cough themselves to death. This is a video from the Mayo Clinic. I didn't put the attribution on the slide, but this is from the Mayo Clinic. It's on YouTube. Somebody, they had a child with whooping cough, and they got permission to record it because, thank goodness, I personally have not seen a case of this in an infant, and I hope I never do. But just watch and listen, and you can see how much this baby is struggling from something that is utterly preventable.
They're just kind of heavy. Uh-oh. There we go. Okay. It's okay. Okay, take a breath, honey. Come on. Almost there. There we go. Oh my. It's okay. It's okay. Yeah. It's okay. Here.
The video goes on for a little bit longer. You get the picture. Enough trouble breathing, right? You could hear the alarm going off because the oxygen saturation started to drop. You see how red the face got there. There's a feeding tube kind of put in through the nose. There's no way this child could feed. So again, this is from whooping cough. So when it comes down to it, bottom line, vaccines save lives, right? We forget because we don't see these sorts of things. And again, as a pediatrician, I'm so happy that these are things that I have to go digging around to find, because again, we've successfully managed to control and keep many of these things at bay. I will point out that we can eradicate some diseases through widespread vaccination. Smallpox is a great one. We don't immunize against smallpox anymore because it doesn't exist anywhere except in 2 highly secure research labs in the globe. So smallpox is an example. We might get there on polio, a few pockets still in the world, et cetera. There's other things not going to happen so easily. Pneumococcal disease, which meningitis and some bloodstream infections and things like that. We all have pneumococcal bacteria living in our nose and throat. It's normal there. And we're not going to be able to eliminate that. So some things we might be able to eventually stop immunizing against, like smallpox. Others, no, not so much. So then you might say, okay, yeah, but then why do people have questions? Why are there all these controversies about vaccines? And I think, one, we got to start with, it's perfectly normal for people to have questions about anything, and people deserve to be heard and to be given reasonable, valid answers based on the science. I want to be really clear about that, right? We shouldn't be blowing them off and saying, don't bother me with that, or that's just ridiculous, or whatever, because I think genuine questions deserve genuine answers. So let's keep that in mind. Let's also recognize that most people actually do think vaccines are important and that they're safe. Just because some people are loud doesn't mean that many people actually believe it. And I'm going to show you some data to back that up. Globally, so there's a great website called Our World in Data, fantastic graphs and visualizations. Look here. If you look at the US, we're at about somewhere north of 85% of the general public say we strongly agree or somewhat agree with the statement that vaccines are important for children to have. Okay, that 85% is not half, it's not a third, it's not 10%, right? This is a lot of people in 2018, not all that long ago, who agree with this. Similar statement. Here's the ones who disagree that vaccines are safe, right? So you want this to be a lower number, means that they support it. And again, it's about the same thing in the other direction, about, 10, 15% strongly disagree or somewhat disagree with the statement vaccines are safe. That's not a lot of people. It's enough that we got to worry about that. We got to worry about what they're telling other people. We got to worry that if they don't immunize, that can actually affect us all. But big picture, most people actually think these are good things. And, in pediatrics, I get asked sometimes by medical students or people wanting to go to med school and saying, well, how do you deal with parents who don't want to vaccinate their kids? And my answer always begins with, I want you to recognize that most parents actually do immunize their children. And most parents immunize their children on time. Really. Even in Madison, where people think, oh, it's all these people, don't believe in that and whatever. Nope, most of my patients are immunized. This is a good thing. So we should just keep that in perspective. So, but then why do people have questions again? Let's remember that most vaccine disinformation is actually created by those who profit from it, and they manipulate people into unknowingly spreading it. So, your relative or someone who says, I heard this about vaccines, I don't think they're getting paid off. I think they're, perhaps listening to some fairly dubious things, but, I don't think they're actually getting paid off. The people who create some of this stuff, though, yeah, if you follow the paper trail, they are usually promoting their own product that usually means has no data or effectiveness to it, and is usually something that is they're making a lot of money off of. There's other forms of personal gain. Some of you may remember the famed 1989 study, 1990 study by Dr. Andrew Wakefield. This was the study that he claimed showed that measles, mumps, and rubella vaccine was connected to autism. He looked at 13 children. That's a ridiculously tiny study. He also did some remarkably unethical things. He collected blood samples from kids without parental permission at his son's birthday party. Yes, really, you can look up this story. How this thing ever got published is beyond me, but it caused major harm in that it caused a lot of doubt. Now, large studies looking at thousands upon thousands, we're talking hundreds of thousands of children down the road, showed no connection between the two, right? But people still walk around claiming, well, there was that study. Yeah, he was trying to make his career on it, and he certainly made his career. Of course, that paper was retracted by the Lancet, the journal, and he actually lost his license in the UK because of the deception and fraud and unethical behavior. I have a million stories like this, so please recognize that some of this is being done intentionally to make someone's career or to profit from it. Vaccines are ultimately an amazing achievement of science. It's saved countless lives, and it's made much more possible for children to have a childhood and, mind you, and an adulthood. Again, graph that's hard to read, but just look at the big picture here. That this is how many children died in the last 2,000 years. Red are those who died as infants or children, so under age 15 is how they define that. Blue is those who died in their first year of life. Okay, so that's the infant mortality rate. And you can see the data points are really spotty until about 1900 because we just don't have good records anywhere in the world. But they had a few bits of data that they pulled there. And you notice most of those red dots are, yeah, up there in the 45 to 60% range. Just think about that. Half or over half of children died before hitting age 15, anywhere in the globe. The blue is the infant mortality. Again, somewhere between 25 to 35%. A quarter of children died in the first year of life. Can you imagine giving birth to a baby and knowing that there was a 1 in 4 chance that they weren't going to make it beyond to their first birthday? And half of them would not make it past age 15. And then you look to see what happened around 1900. Both those numbers plummeted. You can see those lines going practically straight down. This is what immunizations, antibiotics, and other scientific advances gave us, is that now in 2017, globally, this is the entire world, under 5% for youth mortality, under 3% for infant mortality, and we can do much better, right, than that. Even that's too high. Again, this is the whole world, not just the US. So my conclusion from this, and the conclusion of most people, honestly, is that, in a sense, vaccines ultimately cause adults, right? They allow children to live, to thrive, to flourish, and to become adults, because those rates, again, were crazy high. I want to say a few words about the development process. And again, one could spend a lot of time on this, but medications are kind of found through a variety of techniques. Ones that seem to be promising based on initial studies, including animal trials, go to human trials eventually. Then they go through a careful and stringent approval process. They're manufactured and distributed. I want to say a few more words about the trials part, because people always wonder about this. So before they even go near a human, they're looking at the thing, the medication or the vaccine or whatever, and saying, how will it work, right? Let's figure that out as best as we can. Phase 1 trials, which are done on a very small number of human volunteers, is it safe? Do we think that this is going to work okay? Phase 2 trials say, what's the right dose? Okay, we've established safety. Let's continue to look at safety, but also what's the right dose? Not too much, not too little. Phase 3 says, okay, now is this effective? Is it actually doing the thing that we think it should be doing? A lot of things don't make it through these phases because they thought it would work and it didn't turn out it would. And then it goes for approval and licensure. Is it right for widespread use? And then there's actually phase 4. Does it remain safe? Something that's a 1 in a million chance. It's hard to study 1 million people before approval. So you may not see that 1 or 2 cases until it's out there more. I think so phase 4 is to kind of catch those things that are much more rare. So this continuous monitoring, it's not like once it's out there that we stop looking or anything like that. And this is why I find it interesting when I hear statements like this. I heard this a lot around COVID vaccines. I will not be a guinea pig, blah, blah, blah. And that's usually from people who don't understand the research process. It's actually really painstaking. I'm not a researcher. Okay, I'm a terrible researcher. I just don't have the patience to run research trials and all that. I spend a lot of time interpreting research and reading it and and all that sort of stuff. But I will tell you, I have been a research trial volunteer. I actually participated in the COVID vaccine trials. Here is me getting a COVID vaccine. Okay, this wasn't actually the trial vaccine. This was the Pfizer vaccine once it was approved, because I didn't remember to get a selfie when I got the research vaccine. But I was in the AstraZeneca trial. So I got, and I know that I got actual vaccine and not the salt water. I knew how this process works from having read about it and actually gone through research processes. The little bit of research I have done has usually been survey work. And even with surveys, there's like multiple things that have to be checked over and cleared and review boards and all sorts of things. I mean, yes, for a survey. You can imagine for things like vaccines, it's even more. And it was really kind of interesting being on the other side of it and being told all the possible risks, possible benefits, all my rights. I can walk away from this at any point, blah, 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 blah. and so on and so forth. These are painstakingly done. Obviously, I had a good deal of trust that they were doing the right thing, that I willingly and happily, I was not required to do this. I, in fact, had to like keep harassing someone to tell me when they were going to open up the trial. They were not trying to recruit me all that hard, actually, and so on. Other big picture thing, we protect one another. When we make the choice to get immunized or to immunize our child, loved ones, etc., we dramatically reduce the risk of spreading harmful diseases to some folks that are, we got to think about, right? Those who are sick, right? They're already sick from something else. Fine, how do we not give them something that might be pretty bad for them? They're weak in some other way, right? Chronically. Or they're otherwise vulnerable because maybe they genuinely can't be immunized. And by the way, that's really rare. True medical exemptions is actually pretty darn rare. I know one individual who actually had a significant severe reaction to COVID vaccines. Carefully documented, it was real. It was an allergic reaction. Yes, I will forgive them for not completing their series. And we need to protect them, right? Because they want to do the right thing, but can't in their particular situation. There are people in whom immunization may not be as effective. You know, I'm thinking about, for example, the case of someone whose immune system is genuinely knocked down because they're getting some forms of chemotherapy for cancer, right? Immunization is not going to protect them in the same way because we're attacking their immune system in the name of curing something else or addressing something else, right? We need to think about them as well. And likewise, right, even a small chance of infection could be tragic because of these underlying things, right? So we're reducing that risk. And also, all of these things apply to how do we protect the other children in these settings? You yourself, your staff, your own families, you know, you don't want to bring home stuff to your family, and your community, right? So yes, it's about protecting us, but it's also about protecting those around us and thinking carefully about them. Now, some of you may say, okay, yes, but you know what? There's some people that just don't seem to bother getting vaccines. And it's not because they don't want them. They just don't seem to actually care about getting it done. And all. I see a couple of hand raises and questions, and I'll be happy to take questions in just a few moments. So please hold on to those. Thank you. But look, here's the thing: if a child goes to all their regular checkups, they should be offered the complete immunization schedule over time. Virtually every clinic does it, right? It's really unusual to see a primary care clinic that doesn't offer that. But let's keep in mind, for some families, getting the visits might be a challenge. Right? It's not actually as easy sometimes, and transport can be an issue, available time in the day, and so on. We do find when there are government initiatives that make it easier to get immunized, the rates usually go up. So it's often an access issue and not a willingness issue. And we need to recognize that that needs a different set of answers versus, you know, trying to convince someone. I also want you to know this because I don't think this is well known. Most clinics actually lose money by doing immunizations. The actual vaccine is generally covered either by insurance or by the federal Vaccine for Children program. The charge for giving the vaccine, which includes storage, checking the temperature on the fridge to make sure it doesn't drop and the vaccines, you know, are not valid because of not being under controlled temperature, documentation of the giving the shot, putting it in the state registry system so that it's there in the record, actually giving the shot and dealing with often a kid who's crying and whatever, answering questions, all that stuff. In Wisconsin was a mere $3. I think that's about to change finally after years of us griping about it. It's a money loser, like more time and effort goes into that. So why do we bother vaccinating kids if it's a money loser? Because it's the right thing to do, right? Honestly, if it was all about money, we would love to have vaccine preventable diseases because hospitalizing a kid makes much more money than vaccinating them. Clearly, that's, we want people to be well. We're not making money off of this in healthcare. Again, it's a money loser for us, but it's the right thing to do. And then finally, last slide, I use this a lot through COVID, and I just remind people that vaccines are one part of layers of protection, particularly when we're dealing with things like COVID. So all the layers make a difference, and it's Wisconsin, so cheese-based messaging is always good. I want to highlight in the middle, there's a little mouse there. They call that the misinformation mouse, because the more it nibbles away at the cheese, the bigger the holes get, and the more likely it is that we see outbreaks occurring over time. So again, when it comes down to it, vaccines save lives. Decide wisely. They're an amazing innovation. They've transformed childhood as we know it, and we should just recognize them in that key way. All right, I will move to some questions here. And I see one in the chat, and then I know there was a hand raised earlier that I'll come to if the question's still present. How do you talk to a parent about getting their child vaccinated when they don't trust the medical system or think vaccines are bad? Great question. And I think those are two different things in a sense, although they're sort of overlapping in part. One is about trust in the healthcare system. And let's face it, sometimes people have had really bad experiences with the healthcare system. And sometimes historically, even generationally, there's been bad experiences. So let's just recognize that that's a thing. And that's not a bad reason to not trust. I would say, one, helping them connect with a consistent primary care provider that they might be able to build a relationship is a good thing. Other people can also talk about how important vaccines are to them or why they made the decision to immunize. So even if they don't trust the medical system, they might trust someone else who they're willing to listen to. And that can include family members, friends, early childhood providers, faith leaders even. And often when they're hearing it from those sources, it can at least help them get over that barrier there. In terms of thinking that vaccines are bad, I'll tell you, when I have these conversations with families, the first question that when they say, well, I'm not sure about immunizing, the first thing I say is, tell me what your concerns are. And then I shut up and listen, right? Let's listen to what the concerns are, because there's sometimes different types of concerns, and people need to feel heard. They need to feel that they can, that somebody's listened to them and taken them seriously. And then I acknowledge that there's a lot of scary stuff out there. There's a lot of really bad nonsense out there that they can find. And mind you, this actually goes back to long before the internet. There was actually anti-vaccine stuff going on with smallpox vaccine around 1900. So this isn't actually new. It's just that the internet makes it faster and it spreads easier and it sounds more authoritative and so on. So one of the things that we, is like to acknowledge that there's scary stuff out there. Yeah, that's pretty frightening. And if I didn't know what I knew, I would be just as scared as you. Now let's talk about some of the facts, right? And kind of turn to what is it we do actually know. And have a reasonable conversation about that. So that's the approach that I generally take. I also want to highlight for you, there's folks who I think are against vaccines completely and deny the truth of the data that's out there. And it's really, really, really hard to convince them. But I think most people that have a question are actually vaccine hesitant. They've just heard some things that make them worried and they want to have a conversation about it. I'm happy to work with those folks because they're coming with genuine questions. And most people who come with genuine questions, I personally have found most end up immunizing their child on time, on schedule, fully. Because again, I think they feel that they're being heard. And that's the experience of many people who do this work. All right. I know there was a hand raise earlier, but people can put stuff in the Q&A and also in in the chat there, and I'll just stop sharing my screen here. So. Other questions that folks have? Yes, and Maria, I don't know if we're able to actually, with the webinar format, if we're able to selectively unmute people, but I'll answer. There's a couple more questions coming in the chat that I'll address here. The importance of boosters. Yeah, booster immunizations, which are fundamentally, they're no different than the first immunization that you get. Like, so if, for example, you're supposed to get 4 doses of polio vaccine, and numbers 2 through 4 are called the booster doses. They're the same as the original. There's no actual difference. People sometimes think they're somehow different. They're showing the immune system that same thing a second, a third, or a fourth time. Because as you remember, right, sometimes the memory is a little weak. It doesn't completely take the first time. And what they do is in these trials, they say, hey, how many doses does it take? So for example, like again, about COVID vaccines, right? A couple of them, and I'll admit I don't have these memorized because they change so much. But for younger kids, there was a question of, do you give them 2 doses like everyone else, or do you give them 3, right? So it turned out that the younger kids needed more, needed a 3rd dose. So they went with that. They also, there's also boosters in the sense that they cover different types of variations. So for example, I'm thinking about, with COVID, again, just to take a recent example that people are all thinking about, there's the original COVID vaccine, and then they came out with the one that covered some of the Omicron specific ones, right? So that's giving not just a boost to the original vaccine effect, but also adding in some other ones there. So question about the immune boost here. Yeah, I'm talking, people say this, right? Like, well, yeah, zinc so people say, oh, zinc is involved in the immune system, so taking zinc supplements. The studies that have been done have not shown zinc to actually make much of a difference. In fact, the nasal zinc sprays can actually ruin your sense of smell. And I think on average, they found it was a day or less of the common cold. It just didn't seem to make a big difference at all. There's a lot of herbs and supplements that say boosts the immune system. When you see those words, basically there's no research backing that up in most cases. It's very little research, and they're again largely out there to make money. I think we saw there was a hand earlier from Susan Rice. If you're still wishing to speak, there we go. Susan, if you're there, feel free to unmute. You should be able to now. Okay, you may not be there, but we'll come back to you if possible. I see another question that's come in. I see, is it harmful to receive multiple vaccines at one time when they're only, say, 2 or 4 months old? Is it better to space them out? That's a great question, and I've heard that one. There's this idea that will overwhelm the immune system. I got news for you. The human babies in the first few hours of life are exposed to thousands upon thousands of new antigens just from being out in the world for the first time. Their immune system is looking at all these antigens and processing and all this sort of stuff. Kids in early childhood settings are being exposed to so many viruses, their immune system's dealing. The number of antigens in the vaccines given is nothing compared to that. The immune system laughs at this. It's really not a huge deal. Spacing them out doesn't accomplish a whole lot of anything. It makes it more complicated. It means more trips to the clinic and more trips to the clinic that are associated with pain. I have a colleague once whose family chose to kind of spread them out like every 2-3 weeks. Their kids started screaming when they drove by the clinic because they now associated it with a painful event, because it had happened so many times. They did not do it with their second child. They said, you know what, this doesn't seem worth it. Also, I'm going to say, people have asked me sometimes, what's the greatest risk to my child from a vaccine, from being vaccinated? And I say, it's the risk that you get into a significant car accident driving to the clinic. I'm actually not being flip about that. If you look at how many people are injured significantly or killed in motor vehicle accidents in the United States, your risk of being harmed from that is actually greater than of any real harm from a vaccine. But we don't sign all these waivers and have all these conversations every time you get into a car. So with that, we are out of time. Thank you so much for your questions and your and being here today. And I will turn it back over to Maria to close us out. Thank you.
Great. Thank you all for those engaging questions. I'd like to share the objective screen one more time. This is a corrected slide from earlier in today's presentation as we described the basics of child immunizations and the strategies when we're thinking about vaccines. As we identify a little bit more about the Early Childhood Health Consultation Program, we'd love to highlight a few resources that are readily available on demand. We have our resource library found on our website, monthly webinar trainings like this one here, as well as tailored health consultation, which is available to target locations across Wisconsin. We are also very excited to announce our podcast, Teachers, Toddlers, and Tissues, with the first episode launching on March 8th. You can feel free to check out the trailer today, which can be listened and subscribed to using your favorite platform. You can also learn more on our website. Here is our contact information. We'll be also dropping this into the chat in a moment for your later reference. We'd like to say a special thanks to the many early childhood education providers who offer us ongoing guidance, including our very own advisory board of early childhood providers. We'd like to thank our colleagues from other childcare health consultation programs across the United States, our current project partners, and our past project team members. A few logistic reminders. At the end of the event, we'll be posting a Qualtrics survey into the Zoom chat. This is a great place for you to enter your information if you like continuing education credit with the registry. Also, it's a great place for you to offer any feedback in ways we can improve future webinars. Following the event, if you registered for the webinar, you'll receive a follow-up email with a link to the recording as well as a link to the post-webinar Qualtrics survey. And then further following the event, we will enter attendance with the registry if you entered your information in the post-webinar survey. And you can find this webinar recording as well as past webinar recordings on our website. Save the date for our upcoming April 6th webinar. You can go to our website to register and learn more. So at this time, I invite you to go into the chat of this Zoom webinar. There you will find the Qualtrics survey for the post-webinar survey. And at this time, I'd like to say a special thanks for your time and attention and turn it over to Dr. Navsaria for closing remarks.
Thank you so much, Maria. Again, I hope this was helpful. These are important topics, and one of the reasons we chose to share them with you is because a lot of families do ask your opinions. They want to discuss these things with you, and we're hoping that by equipping you with some of the useful ways to think about this, you're able to help them make a wise and responsible decision. Thank you.